friends, welcome to Dr. Ram's Medical Coding Academy. We are now seeing the series of modifiers. Today, we are going to discuss about modifier 22. Just to make you understand, imagine you are working in a company as a medical coder after taking training from our academy. Now, the manager of that company gives you a target of 100 medical reports to be coded. And if you are going to code like more than 100 reports every day, like 120, 115, 110 on each of those working days, then it is pretty normal that you can expect an increased salary or an increase in your payment, isn't it? So when you just apply this concept to other industries, people might be working as overtime. They say as OT, isn't it? So at that time, it is reasonable for those employees to expect an increased payment beyond their salary. Now apply this concept to doctors and qualified healthcare providers in the United States. When a doctor is going to do something beyond his usual work, then you need to think about modifier 22. Come, let's see the description of modifier 22. The CPT codebook states that we can report modifier 22 for increased procedural services. Now, what do you mean by this? As an increased procedural service, the doctor does a procedure or a service. Now, there is going to be something increased. Now, what is this increase? Now, this increase is what we are going to see in the subsequent slides. You need to understand that this modifier 22 can never be reported for an E&M code. It should be reported for surgical CPT codes and of course for other ancillary services like radiology, pathology and medical tests. Every healthcare encounter is going to be unique, isn't it? So now imagine there is a clinical encounter, there is a circumstance and that circumstance is being altered. Now, how it is altered? Now, you can say that a doctor does a surgery and the surgery time gets prolonged. Imagine a doctor does a surgery for 2 hours usually, but for a morbidly obese patient, now the surgery is being lengthened and he spends 4 hours with that patient. So, this is an unusual circumstance. It's no fault of the provider. But still, the surgery time got prolonged, isn't it? So we can figure out such unusual circumstances or certain extenuating circumstances as to where we can assign modifier 22. Let's see here. This modifier 22 can be reported whenever there is an increase in time. Since we say it as an increased procedural services, there could be an increase in time. Secondly, there could be a technical difficulty due to complexity of the patient's conditions or due to complexity of other circumstances. Now we can assign modifier due to certain technical complexities or other extenuating circumstances. Now what happens? The doctor can face technical difficulties. Same way, the patient's condition. Say for example, when a patient has multiple comorbid conditions, now, those conditions can also significantly affect the surgery. So, these are some of the criteria where we think about the surgery time that has been extended, or when there is a technical difficulty, or when the patient's conditions warrant more physical and mental effort on the part of the provider. When a doctor is reporting a modifier 22 to a surgical CPT, for instance, now let it be a colectomy or an appendectomy or for any other procedure. Now, what should be the documentation requirements? We have seen that time is one of the most essential ingredients. When the surgeon is going to talk about time, he cannot simply say the time that he spends. The doctor will have to document how much of time he has spent in excess and what's a usual or the typical time that he spends with such surgeries. It is advisable that the doctor gives enough focus on the total time as well as the time that the surgery has actually lengthened. When it comes to the technical difficulty, the doctor will have to explicitly state the intensity of the service and the significant mental and physical labor which is invested. Now, there could be intraoperative complications. Now, patient can go for an atrial fibrillation or patient can have severe hemorrhage. During such circumstances, a physician can assign Modifier 22. Now, let's see some of the incorrect usage of Modifier 22. The surgeon has simply stated that the procedure was difficult without accounting for the technical difficulties or without explaining what was difficult. There isn't a sufficient documentation to attest to his statement. Secondly, when the surgeon states that he spends time in lysophederations without accounting for the time or without accounting for its difficulty. Some examples could be like mere documentation that patient is obese. Now, these things cannot fetch a payment, or when the insurance company is going to look out for details in the surgery, when the insurance company is going to look out for documentation for reporting Modifier 22, so we need to include all the relevant details. Imagine that the doctor has reported Modifier 22 for a particular surgical claim and that gets denied. Now, what should you do as a medical coder? Just check if this assignment of Modifier 22 is warranted, if this is justifiable. You need to ensure that there is adequate documentation is there in place, and this record will have to prove the substantial work that is being done by the provider, which is over and beyond his usual service. It is advisable that the physician include the substantial portion of the work and the additional work in a surgical or medical record. Here's an example where we can assign Modifier 22 without any complication. Now let's see. Roja undergoes partial right colectomy for malignancy, during which extensive lysophedation is performed for more than 2 hours. I hope you understood the scenario. The patient undergoes a right colectomy. Colectomy is the partial or complete removal of a colon. It is stated that the patient undergoes a partial colectomy. And why do you think that it is being done? For a malignancy. Now, it is not sure whether this malignancy is a primary site or a secondary site, isn't it? Since we don't have the terms like metastatic or primary or secondary, now let's assume that it is a primary malignancy and the site is also not specified. If you see the medical necessity, patient has a malignancy, which is a cancerous condition. So we have reported code C18.9, which is a malignant neoplasm of colon, and the CPT code is 44140, which we'll have to select it from the digestive system chapter of the CPT book. And here we have assigned Modifier 22. Now, if you look at the scenario, the surgeon clearly documents that there was an extensive lysophederations, and he has spent time for like 2 hours for that itself. So usually lysophederations is included in a procedure. But when the surgeon does an extensive lysophederations, now we can report Modifier 22 along with the CPT code. I hope all of you understood this session on Modifier 22. If you have any queries, please post in the comment section and I'll see you in the next video. Thank you very much.